Hello, this is Dr. Kibrom, the Chief Executive Director of Ayder Hospital in Magala. The impact of the war in Tigray is tremendous, and if you see the impact of this war in health systems, it's also very severe, and it has destroyed more than 80% of health facilities in the entire region. And following the capture of Makala in last June 2021, Tigray has been under de facto siege in 360-degree blockade. So there was no resources, no drugs, no supplies, and equipment is coming to Tigray. And this has resulted in deaths of many patients and suffering of a lot of people in our region. We couldn't give the appropriate treatment to our patients. So the suffering and the misery of the people, it cannot be expressed easily. Hospitals are not working, health centers are not working, and the doctors and other health professionals in these hospitals were, suffering with the patients altogether. We need to talk about resources like drugs, like supplies. It was hugely impacted. We have lost many patients who need dialysis in our hospital because these resources have to be imported, and because of the blockade we couldn't bring dialysis materials. We have lost patients with DM because they couldn't get insulin and other antidiabetic drugs. We have lost almost every cancer patient because in 2 years' time we haven't seen any chemotherapy drugs coming to our hospital or our region. Since the start of the war in November 2020, most of the staff members of these hospitals and health centers have fled the hospitals, and they have to come to Magala or other major cities which were relatively less affected by the war, but they couldn't go back to the hospitals and health centers as there is no favorable working environment in these hospitals. Most of them, they have lost their equipment, or physically they are damaged, destroyed, and some of the most important equipment of these hospitals were looted, and they are taken to other regions as well as countries like Eritrea. So these hospitals and health centers, practically they are now in ruins. So the health system is greatly affected. The staff members as well as the equipment, supplies, and so on are not there. So you can say the war has destroyed almost every aspect of health aspect in Tigray. Our staff haven't been paid in more than 18 months now with no salary. Everyone had to come to the hospital and treat these patients, treat the delivering mothers, treat the malnourished children, while the staff by themselves have malnourished children in their houses. They have to come to our hospital and care for these patients. So it was very, a tough year for us. It is very, challenging to work without any salary, without any payment. But what makes it more challenging is you have the capacity, you have the knowledge, how to do things, you know how to treat patients, how to do operations, but you cannot do it because you don't have the right materials. So to see patients dying in your hand while you have the capacity, but you don't have the resource, so seeing these patients dying was very tough for us. It was very, touching. It was painful for us. So our staff, our entire staff, have been, tortured the whole 1.5 year now. Our hospital is not getting any budget from any government source, so we entirely depend on donations from individual donations from organizations, and NGOs like ICRC, WHO, they have been with us throughout the conflict, and they are the primary supplier of drug supplies and equipment. With this, with no budget, it is very difficult to run a hospital, especially if the hospital is under siege, if the entire region is under siege, and if you cannot buy medication supplies, drugs from the market, is very difficult and very demanding. So it has been, very testing time for us. We are asking our friends, our brothers and sisters in diaspora, and the number one provider of these resources has been the diaspora. They have been raising resources, they have been raising funds, and they are sending especially monetary fund and supply, help to our hospital. Call we do to our diaspora sisters and brothers and friends of Tigray in general is to help us in raising fund and sending it to Tigray. So this is the important issue that we need currently. It necessarily shouldn't be monetary help. It could be in kind as well. As I have told you earlier, most of the equipments are destroyed, looted, and they are out of use. So we need also help in terms of instruments. It could be hospital beds, it could be operating tables, light, syringes, gloves, or BP apparatus, anything that is important in a hospital. We are glad to accept it. We have hospitals to be reconstructed. We have, a country to be rebuilt now. The whole region is now under rains. So to help rebuild it, we will need your help. And also, I have to use this opportunity for everyone to follow the good deeds of the associations that are currently helping us. So please help us. Please send whatever medical equipment, medical resource you might come across. We are glad to receive it. Thank you.